Dr. West, what can you do for diverticulitis? Well, diverticulitis is inflammation of basically your stomach. And what it is, it blocks the absorption of nutrients through the microvilli. And there's some foods that help. There's some foods that are problematic, but diverticulitis, that's a lower GI problem, is you get weak spots or inflamed spots in the intestinal wall that give way to pressure and they get irritated. It's like like a car tire that has a bulge in it. That's what a diverticulitis is. And it also can cause other problems or be associated with nausea, with fever, bloody bowel movements. It can be a sign of infection in the GI system. It can be a part of the fistula problem, which is a connection of an infection from one area to another. But one of the best things that we can do again is reduce inflammation. I like using something called a FODMAP, and it stands for fermentable oligosaccharides and disaccharides, monosaccharides, and polyols. In this diet, you want to be really careful with apples, pears, with dairy products, with fermented foods, with beans, soy, cabbage. And one of the things that may help with that is if we can avoid those inflammatory chemicals, that it helps to reduce things. And there are certain types of fiber that can really help. Now, in this, some of it is some of the ancient grains, amaranth and spelt. That helps to basically bind up with some of the toxins in the body. But also looking at when things start to improve, moving towards a high fiber and move to low fiber, which can really help to prevent future diverticulitis flare-ups. So we're looking at white rice. We're looking about foods like applesauce. We're looking at fish. We're looking at eggs. We're looking at beans, carrots, asparagus, kind of a clear diet. So water, ice chips, bone broth are all considerations. Now, those are some big hitters on diverticulitis, but let me kind of give you some fast codes or fast things that help with diverticulitis. It's been my experience, if you want to heal and soothe irritated GI tissue, using vitamins is really important. Vitamin A, vitamin D, vitamin E, vitamin K, which, by the way, there's some subvitamins that are really important. Vitamin F, vitamin G, vitamin P, vitamin T are all important factors. Those are part of those are the bioflavonoids family, but that really helps to heal and soothe irritated GI tissue. I also really like healing clay, particularly Montmorillonite clay, where you can put this in water, stir it up, and then basically it will have a little cloudy layer at the bottom. And then you drink. There's bentonite clay, there's Montmorillonite clay. I've seen some really good outcomes using clay to bind up with the chemicals and the poisons. Another one that I really like is an herb called okra, and they combine it with a digestive enzyme called pepsin. So the product's called okra pepsin, and what it does for diverticulitis in the lower GI system is it acts like a vacuum cleaner or a lint roller, where I see it really help to pull things out. And I've seen this work for patients over the last 24, almost 25 years. It'll be 25 years in practice in January. This is one of the first things that my dad taught me. And I just love using okra pepsin. Okra is one of my favorite herbs for diverticulitis. Now, looking at things to do that are more advanced, I really like drinking ozonated water. This is why I think everybody should have an ozone machine at home in their cupboard, in their emergency supplies. You can drink it. You can also use a ozone enema. You use a little tiny catheter, literally about the width of this. And when you use that, what happens is you fill up a syringe or bag full of ozone, you connect it to the catheter, you insert the current catheter up the rectum. And what happens is it helps to heal those bulges and that inflammation. I've seen it would work really well with bleeding conditions. And so they call it insufflation therapy. Doing neural therapy on the outside of the stomach, also really important for scars.